Anorexia nervosa is an eating disorder distinguished by an abnormally low body weight, a strong fear of gaining weight, and a distorted perception of weight. People suffering from anorexia place a high value on controlling their weight and shape, and they will go to great lengths to achieve this goal, even if it is mean interfering in their daily lives. It is a severe psychotic disorder that primarily affects female adolescent and young adult adolescent and has a peak onset adolescent. Although anorexia most commonly manifests itself during adolescence, an increasing number of children and older adults are being diagnosed with disorder. You can tell if someone has anorexia by just looking at them.
In Malaysia, it is estimated that the lifetime prevalence rate of anorexia is 1.0%. Between 0.9% and 2.0% of females and 0.9% to 0.3% of males will develop anorexia. According to newspaper reports in 2018, for every 10 to 20 females with eating disorders in Malaysia, it has been reported that there will be one male suffering from a similar problem, although males may less likely to come forward about such disorders. While it is not surprising to know that males suffer from anorexia too, these figures are potentially inaccurate and have been difficult to verify. After all, the statistics can only rely on people who admit they are suffering from anorexia. A study that has been conducted in a university based in Kuala Lumpur concludes that the prevalence of students having the risk of eating disorders is 13.9%. While there may be a dearth of statistics on how many people in Malaysia suffer from anorexia, there are certainly reasons for why the phenomenon may exist in the Malaysian context.
Diagnostic criteria for anorexia nervosa. According to DSM-4, diagnostic criteria for anorexia nervosa are 1. Refusal to maintain body weight at or above a minimally normal weight for age and height. For example, weight loss leading to maintenance of body weight less than 85% of the expected, or failure to make expected weight gain during period of growth, leading to body weight less than 85% of the expected. Second, intense fear of gaining weight or becoming fat even though underweight. Third, disturbance in the way in which one's body weight or shape is experienced, undue influence of body weight or shape on self-evaluation, or denial of the seriousness of the current low body weight. Fourth, in postmenarcheal females, amenorrhea, that is the absence of at least 3 consecutive menstrual cycles. 5. There are 2 types of anorexia nervosa. First, restricting type, in which the person has not regularly engaged in binge eating or purging behavior. Second, binge eating or purging type, in which the person has regularly engaged in binge eating or purging behavior, that is self-induced vomiting or the misuse of laxatives, diuretics or enemas.
Social factors. Eating disorders are more common in societies where thinness is the ideal, compared to societies where a more rounded body is the ideal. Troubled family relationships. Teenagers with anorexia are obsessed with controlling their diet. This is because eating is the only thing that they can control from their parents. Psychological factors. A struggle for perfection and control. People seek autonomy, which is the control over what they can do and their diet planning. Perfectionists, on the other hand, set unrealistically high standards for their looks and body weight. Depression and low self-esteem. Women with anorexia may be preoccupied with their social self. They often depend on others for self-esteem. Negative body image. People with anorexia often compare their current and ideal body image, and sometimes their ideal looks is way too extreme. Dietary restraint. When people get too hungry from extreme dieting, irrational fear of losing control and binge eating may arise, which are the symptoms for anorexia. Biological factors. Weight gain or loss results from the interplay between behavior, peripheral physiological activity, and central physiological activity. Genetic factors. Inheriting a thin body may increase the risk for anorexia, especially when combined with the culture of thinness and perfectionism. Genetic mechanisms and gene-environment interaction could possibly trigger anorexia.
Next, we will proceed to the treatments for anorexia nervosa, which include medications and psychotherapy. So what medications can be used for this disorder? Eventually, up to this day, no medications are approved by FDA to treat anorexia nervosa because none has been found to work well enough. However, antipsychotic medication called olanzapine may be beneficial, in which it may reduces their distorted belief about body shape and size. One side effect of this drug is weight gain. Next, what about psychotherapy? The first approach that can be used is family therapy. This is the only evidence-based treatment for teenagers with anorexia. Since adolescents with anorexia are unable to make good choices about eating and health, this therapy mobilizes parents to help their child with refeeding and weight restoration until the child can make good choices for their health. Research shows that patients treated with this therapy for 5 years show 75 to 90% of full recovery. Next, cognitive behavioral therapy or CBT can also be useful. Its main goal is to normalize eating patterns and behaviors to support weight gain. The second goal is to help modify their maladaptive thoughts concerning weight and food, and also their own self-image. Other than medication and therapy, in severe cases of anorexia, treatment like hospitalization may also be done by physicians, which include intravenous feeding followed by rigorous control of calorie intake. However, if this approach is not followed with psychiatric treatment, the result will be temporary and the patient will soon need medical attention again. In conclusion, although some treatments may be successful, they do not work overnight. Hence, long-term psychological and medical attention usually is needed for anorexia nervosa.
Anorexia nervosa can cause a lot of damage to our body and can be harmful to our life. Therefore, if you have any symptoms of anorexia nervosa, go seek help from the expert.